Hi, I'm Dr. Joe Niamtu, LoveThatFace.com, and thank you for tuning in. Today we're going to talk about cosmetic blepharoplasty or eyelid surgery. And you know, when I go on YouTube to look at something, whatever, how to fix something in Microsoft Word or something, you look at videos and there's 20-minute videos and there's 2-minute videos, and you tend to want to get that short video. But there are some things in life where you need the longer version and you need to invest time in it. And I think if you're considering eyelid surgery, it'll be worth you spending 15 or 20 minutes looking at this video, okay? So, again, my name's Dr. Joe Niamtu. I'm a cosmetic facial surgeon. I do cosmetic facial surgery in Richmond, Virginia. I operate from here to here, and I don't do boobs, bellies, and butts. I'm a surgeon, I'm a teacher, I'm an author. I love what I do, I'm passionate about this, and eyelid surgery is one of my favorite procedures. Now let's talk about that for a minute. Why is that? Well, the eyes are amazing, okay? They're just amazing. You can tell so much about somebody, including their age, by looking at their eyes. The upper face tends to age faster than the lower face, so it's not uncommon that we're doing cosmetic eyelid surgery on people in their 40s, whereas my other favorite procedure is facelifts, and that's usually a little bit later in life. So, you know, as we age, we tend to get thick skin, redundant extra skin. We get puffy fat bags, and we just look older and more tired. And it's not uncommon. People come in here and they're in great shape. And like, hey, Dr. Joe, you know, I go to the gym, I watch what I eat, I have a healthy lifestyle, and people keep asking me if I'm tired or if I have been up all night. So the eyes kind of give it away, all right? And eyelid surgery is one of the most popular procedures. And from a surgeon standpoint, it is one of the most meticulous, precise surgeries that I do, because it's a game of millimeters. Even a millimeter here or there that is different from one eye to the other can be problematic, all right? And that's why I love it. I really like precision things, and you're wearing magnifying glasses, and I use lasers, so I don't use scalpels or scissors. And because you use laser, patients don't bleed. And if you don't bleed, you have usually no bruising, faster recovery, less discomfort. But we'll get into that. So here's how I want to cover this. I want to talk about brow, about upper lid, about lower lid, and about the skin of the lower eyelid as well. Kind of go in that order. I'm going to talk to you right now. Then I'm going to do a little lecture, so to speak, a little PowerPoint, and show you pictures and some video of how and why we do things. And then we'll follow that up with some before and after, a little case presentation. All right, the brow, number one. If you go for a consult for eyelids, if your surgeon is really on top of things, the first thing he or she's going to talk about is your brow, because that has a lot to do with your eyelids. Now, most patients don't need a brow lift. Some people would benefit from a brow lift, and at least it needs to be presented as an option for the patient. Some people are all about brow lifting. Some patients don't want that. But if you had an aggressive blepharoplasty, or you had blepharoplasty and then 10 years later you had another blepharoplasty, and then you wanted to have your brows lifted, there might not be enough skin for you to close your eye. So brow position is very important in the initial evaluation, as is making sure patients are, you know, they don't have glaucoma or any other eye problems. The two things that we have to do with eyelid surgery, or all our surgeries, number one is safe. You have to be safe. You have to have a safe environment, safe surgery center, safe anesthesia, safe surgeon, safe staff, okay? And number two, you have to look good. If you don't look good, I don't look good, all right? And I know that's selfish, but it's your face, it's my reputation, all right? So let's move on. We talked about the brow. Let's talk about the upper eyelids. What happens is we get redundant extra skin. And for females, one of their biggest complaints is they can't wear eyeshadow, all right? Or their makeup smudges, and they have this redundant skin, and it makes them look old. So what we do, and I'm going to show you in the rest of this presentation, is we outline a very precise, again, I measure this with millimeters, a very precise outline, and we remove some of that extra skin and muscle and fat, if you need fat removed as well. And most people do need some recontouring. And all upper eyelid surgery is done through an external incision. So you really don't see that scar when your eyes are open. Now you see that scar at first when you have stitches in there, and I use dissolvable stitches. We see a lot of out-of-town patients. So I use dissolvable stitches so patients don't have to go back to their city and have to worry about getting their stitches out. So upper eyelid surgery, I use a laser, as you're going to see, to take off the skin, the muscle, and recontour the fat. And then we close that. So, you know, it takes probably about 25 minutes to do the upper eyelids. Now, lower eyelids, okay? There's a lot of caveats here, especially if a patient has loose eyelids. When you pull your lower lids down, if you were looking in the mirror and you let them go, they should go all the way back up without you blinking within a second, all right? And that's just one of the tests. But if you're going to have lower lid surgery, you got to make sure that you don't have lower lid laxity. If your lower lids are loose or lax, then we have to do a little procedure called a canthopexy, where we actually tighten that lower lid and anchor it. And that's just part of the surgery that we do. Now, for years, a lot of surgeons did lower eyelid surgery by making an incision under the lash on the outside on the skin. And, you know, I mean, some doctors do that, and that's fine. But that procedure, I'm pretty sure that most people would agree, has a little bit more liability for having lower eyelid malposition. In other words, cutting skin away and going through the orbital septum, which is a layer that you traverse with that approach, can pull down on your lids. And that's a bad deformity. You don't want to have that happen. I'm not saying that everybody that does that surgery has that happen, but you have an external scar, and I do personally believe that you have a greater chance of lower lid malposition when you go through that. I think a more contemporary approach is transconjunctival, and that's when we go through the inside. I use a laser, I make a small incision on the inside of the eyelid, and then I remove any excess fat or recontour it, and there's no scar, okay? So, and a lot of people ask about fat transposition, you know, where you reposition the fat instead of taking it out. I think it's fine if you're taking out only the excess fat. It's not going to hollow you. And, you know, if your doctor or somebody does fat repositioning, that's fine. Personally, I'm not a fan of it, but that's okay. I'm just telling you what I've done. I've done well over 5,000 eyelid surgeries, and I'm, you know, over the last 2.5 decades, and I can just tell you what's been really safe and predictable for me. And I think what I'm talking about is pretty common. When I go to a meeting and I hear my other friends of plastic facial plastic, oculoplastic, ophthalmology, dermatology, maxillofacial, whoever, I think that's what I'm talking about is really contemporary ways to do this, okay? So I like to do the lowers from the inside. Now, there's only one negative thing about doing the lowers from the inside. That doesn't address the skin. So on doctors that make the external incision, what they do is they cut some skin off, okay? If you cut too much skin off, that's when you have to worry about pulling the lids down. And if you don't cut enough off, then you still have wrinkly skin. Now, what they're doing is they're cutting some skin and maybe some muscle, and then they're sewing it back. So they are stretching your old skin, your 50-year-old, 40-year-old, however old you are. They're just stretching that. So it looks better for a while because it's stretched. I like to use the CO2 laser and do laser resurfacing on that lower lid. And that tightens the skin, improves the wrinkles, but it burns off the old skin. And it's making new, what I call baby butt skin, and it's lighter and brighter and tighter, okay? So my go-to procedure on the lower eyelid is the internal incision, transconjunctival, with CO2 laser resurfacing. Takes a little bit longer to heal. Most people are back in makeup in about a week, and they're going to be pink for a while. But I think the trade-off is well worth it, okay? The only time I ever make an external incision, and I maybe do that once a year, twice a year, is if a patient has orbicularis hypertrophy. Some people, when they squint, they have a big ridge there. It's not fat, it's just muscle, okay? So we've talked about brow, we've talked about upper lid, I mentioned canthopexy, we talked about lower lid, and we talked about lower lid skin, all right? And what we're gonna do is I'm gonna go through this little lecture, and I'm gonna show you actual videos of the procedures, and I know that makes some people squeamish, but I don't think it's too bad. But I want you to notice what you don't see. you don't see blood, okay? And if you watch people that do surgery with scalpels and scissors, usually there's more blood and there's bleeding that has to be controlled. And when you have what we call a clean surgical field, you can see better, you can be more precise, you can operate better. So I'm a big fan of the laser or radio wave microneedle. We'll talk about that as well. So this is my kind of little brief rundown on cosmetic blepharoplasty. Obviously, there's many doctors all over the world that are very good at doing blepharoplasty. And if you're looking for somebody to do this, make sure you have somebody that has done a lot of it. They can show you their work. They have a fully accredited surgery center. They have patient safety and predictable outcomes. Again, on a selfish note, we see patients from all over the world and all over the country for sure. And it's my honor to see these patients, and I'm happy to look at pictures. You can email us at info@lovethatface.com. This is really one of my favorite procedures, and I'd be happy to talk to you. So stick around, and we're going to look at some videos and lectures and before and after pictures. Hi, I'm Dr. Joe Niamtu, lovethatface.com, and now we're going to move into the lecture part of this presentation, and I'm going to do a little PowerPoint lecture here for you. And again, I'm in private practice of cosmetic facial surgery in Richmond, Virginia. So I have written a number of textbooks, and this is my current book, which is one of the best sellers on Amazon for medical textbooks. And I'm in the process of writing the next edition. And this is my chapter on cosmetic blepharoplasty or eyelid surgery. And I consider myself a surgeon, an author, and a teacher, and I love to publish, I love to teach, and I love to operate. So we're going to talk about cosmetic eyelid surgery, and I'm going to actually show some pictures of and some videos, a couple of them, intraoperatively, in other words, doing the procedure. So if you're one of those people that can't stand to look at surgery, then you may want to look at some of these next slides with caution. As I said, I've done over 5,000 eyelid procedures, and it's one of my favorite procedures, and if you follow me through this presentation, you'll find out why. So let's talk about the eyelid skin. It's some of the thinnest skin on the body, and we have a lot of different things that happens as we age. So when we get this extra skin, you get what's called hooding, and that's when the skin hangs over, it's redundant, and it actually hangs over sometimes the eyelashes and blocks your vision. Dermatochalasis is a fancy word for skin wrinkling, and steatoblepharon is a fancy word for fat protrusion. So these are the basic things we see: extra skin, extra fat, and crinkly skin. So a lot of people really don't understand that they're blepharoplasty candidates. One of the things I do to show people is I'll pinch their side of their eyelid, and when I let it go, they have all this excess redundant skin. So that's exactly what we would excise doing surgery. Now, the eyes, as I told you, are the seat of the soul, and they really show a lot about us. If you looked at this picture and you covered the center part, okay, you would see probably somebody that looks like a younger person, but when you look at the eyes, that really gives it away. So you have hooding, you have fat protrusion, and you have severe skin wrinkling and what are called festoons. We'll talk about those in a minute. There's also a condition where people think it's fat, but it's muscle. This is called orbicularis hypertrophy. And in this situation, that's muscle. So you can put a little Botox in there, or you can excise some of that muscle, but it's important to differentiate that from fat. Festoons are these boggy, waterlogged tissues that are at the junction of the lower eyelid and the cheek. And until laser technology, these were very hard to treat, but we treat them frequently with laser, and we'll discuss this. So one of the things about, here's a mom and her daughter. So one of the things, especially with lower eyelids, is heredity can play a big part in what's going to happen to you, regardless if you stay out of the sun, take care of yourself. We can't change our genetics. So sometimes these conditions are heredity. In terms of anatomy, okay, and I'm certainly not going to bore you with that. That's not the point of this lecture, but I just want to say that the eyes have some of the most complex anatomy of anything in the body. It's an amazing organ that allows us to see, and it has so many layers of nerves and blood vessels and muscles, and it's such a beautiful orchestration of anatomy. But whoever does eyelid surgery has to understand this, and that's very important. If you're going to see someone for eyelid surgery, experience is very important. All right, so when I talk to medical students or residents, and I always talk about how important the eyes are. So you have 10 fingers, you have 10 toes, right? If you lost one, I mean, you can get by. You have 32 teeth, same thing there, but you only have 2 eyes. And again, serious complications with eyes are extremely rare, but the who does your surgery has a lot to do with it, and how you take care of your surgery also has a lot to do with it. So one of the big things about blepharoplasty is how the patients present to my office, and they'll say, "Hey, Dr. Joe, when I look in the mirror, I see somebody looking back at me that looks older than I feel. I eat right, I exercise, and yet I have all these extra skin and fat, and it makes me look older. And my friends tell me that I look tired, or did I not sleep?" So this is really a common reason for people to have eyelid surgery. One of the repeating things you're going to hear me talk about throughout this lecture is lower eyelid malposition. And this is a complication that happens when someone does eyelid surgery, and there's a lot of different things that can cause it, but basically they take too much skin or make an incision on the outside, and what it does is it pulls the eyelid down, and it's a deformity, really, and it can cause dry eyes and a lot of problems. So that's something you want to avoid at all costs. Again, this is a patient, and if you look at this patient before surgery, they say, well, yeah, they do have a little bit of scleral show, and you can see that their lid is a little bit loose. But when you pull down on their eyelid, it's really loose. And if an inexperienced surgeon does surgery on this patient, they can have devastating problems. So we do evaluations. 2 of the common ones are called the SNAP test. This is the first one I'll talk about. And on a person with normal eyelid tone, if you pull down on their lid and let it go, it'll snap back up into the correct position without blinking within a second, okay? People that have eyelid laxity, when you pull down on that lid and then let it go, it doesn't go back to normal. And that right there is a setup for huge problems if you don't have an experienced surgeon. So we can still operate on these patients, but we have to tighten the eyelid with a procedure called canthopexy, and we'll talk about that. So canthopexy is tightening of the lower lid. There's a lot of different ways to do it. It's a relatively simple procedure, the approach that I use, with a special type of suture that stretches or tightens actually the lower lid into a tighter position, so when you do surgery it's not pulled down. And again, if you have loose lids, your surgeon either needs to know how to do this procedure or a similar procedure, or they should refer you to somebody that can. Now, another big thing, as I spoke about earlier, so this patient had 2 upper eyelid surgeries. If you look on the left here, looks pretty good, but now she wants a brow lift. So I say, okay, well, we'll lift your brow. And then when I lift her brow, she can't close her eye. And the problem is that she had skin removed twice, and nobody ever told her that she was a candidate for a brow lift. And as I mentioned, when you go for an evaluation, the first thing that your surgeon should do is discuss your brow. Whether you are a candidate for a brow lift or not, whether you want one or not, it's important to talk about that because some patients want a brow lift, and if you take too much skin away, they won't be able to do it. Plus, if you take too much skin away or you do it several times, it could actually pull the brow down. So discussion about brow lift is an important part of the evaluation. Now, I want to talk a little bit about what we do right before surgery. And as I said, eyelid surgery is so precise and so intricate, and it's a situation where a millimeter can make a difference. So we take a lot of time before surgery to correctly mark the eyelids. And there are a bunch of ways to do it. I'm just showing one example, but it is extremely important to do this. And in my opinion, it should be done in the upright position before any anesthesia is given, because position and local anesthesia can change the dimensions of the eyelid. If somebody lays down, it's going to be different from when they're sitting up. So, experienced doctors have different ways to mark, but again, your surgeon will probably mark you with a millimeter device. It's very precise. And then you have to make sure that the amount of skin you take away will still enable the patient to close their eyes after surgery. Once again, if a patient is over-treated and they can't close their eyes, that's a bad situation. Their eyes water, it's painful, and it could actually damage their cornea. So I think good surgeons, and I certainly am conservative when I do eyelid surgery. Maybe 2% of my patients, I need to go back and remove a little bit more skin, and I can do that awake with local anesthesia. It's a very simple procedure with really no recovery. But if you take too much away, you've got your hands full. Now, when we talk about operating, a lot of surgeons, probably most surgeons, use a scalpel. And the thing about a scalpel is it's just, it can be a very bloody procedure. I only use lasers or radio wave surgery, and these are bloodless. You can see here that there's just no blood. And when you make incisions and excise skin and muscle and fat, and when you do this without bleeding, you have faster recovery, less pain, and less bruising. There's no doubt about it. And I never use scalpels. I'm not saying that people that do are doing anything wrong. I just like the higher technology devices for this type of surgery. And again, you can see me using my CO2 laser and making that incision. There's just no blood. And then when we remove that skin, it's bloodless. So that's very important. The other great thing about using the laser and bloodless modalities is that you're not wasting time trying to stop bleeding. So the surgery is actually faster. To do 4 eyelids, and most people usually do uppers and lowers at the same time, but not everybody. Some people just do their lowers or just do their uppers. But it takes less than an hour to do 4 eyelids, and obviously less than that if you're only doing 2. So using technology not only makes it easier and safer, but it also makes it faster. Same thing with the radio wave microneedle. We make an incision, it's bloodless, and remove that extra tissue without having any bleeding. Literally, I can usually measure the blood loss from 4 eyelids, 2 upper, 2 lower, on a Q-tip. I mean, it's just virtually nothing. Now, when we go through the next layer, there are 2 fat pads in the upper, and some people have a lot of fullness in the upper, and we'll conservatively recontour, remove some of that fat. Some people don't need any fat removed. And again, we do that with a radio wave forceps, so it's a bloodless procedure. One of the problems with bleeding in eyelid surgery, if you bleed and it comes out your stitches or the front of your eye, a little bit of bleeding is not a problem. But if you would have uncontrolled bleeding and it goes behind your eye, this is something that can be extremely serious, and it could even cause blindness. But again, that is so rare. And in over 5,000 blepharoplasties. I've never had a severe complication with eyelid surgery. It's something that I really take my time and really go out of my way to prevent bleeding. Um, you can close this with dissolvable stitches, which I usually do. I see a lot of out-of-town patients, and it's kind of a hassle for them to get their sutures out when they go home, so I use dissolvable stitches. But on patient with pigmented skin, I use a suture that I have to remove because it just has a little bit less inflammation, which can be important on skin of color. So if you look at a patient, here's a patient 1 week after blepharoplasty on the upper eyelid. Here is 1 month. The scar is starting to improve. 3 months, you really can't hardly see it, and that's a year later. So, you know, not everybody has excellent scars, but it's really rare that somebody has a ungraceful scar. And if they do, that we'll use steroid cream or inject steroids or laser it to improve that scar. But generally, this area scars really well. Although in a week, it looks, you know, it's very noticeable, but you don't see it because your eyes are open. So patients often worry about their scar, and I just tell them, look, it's going to look worse before it looks better, and then it's going to get really good. So what we're doing is we're using the CO2 laser, and I'm making an incision on the upper eyelid, and you can see that there's not a single drop of blood. And that's what's so important in eyelid surgery, is not to have bleeding. And there's no other instrument that really is as hemostatic as the laser. And so here we are removing some of the skin with the laser. And again, you're just not seeing any bleeding. And we remove a little bit of muscle in the average blepharoplasty case. And when you take this muscle off, then the next layer is the orbital septum. And we make an incision through there. And this is the central fat pad. There are usually 2 fat pads in the upper lid. And if we're going to remove fat here, we do it very judiciously. You don't want to remove too much fat in that area. And then we put holding sutures, and finally we close this with a running dissolvable stitch. Now we're going to talk about lower eyelid blepharoplasty. So when I talk about lower eyelid surgery, first I want to tell you about a procedure that I don't do, and that is a skin approach, what's called a skin muscle or subciliary approach to lower eyelids, okay? So a lot of surgeons used to do it this way, and some people still do. And the problem is when you make an incision out there, well, there's 2 problems. Number 1, you have a scar. And number 2, when you cut through this layer, sometimes it can pull down your lower eyelid because it can retract after surgery. Now, I'm not saying that you know, nobody can do this type of procedure, but I can tell you, and I know a lot of expert blepharoplasty surgeons who will say that there's a greater chance of having lower eyelid retraction with this type of approach, okay? So, you know, I don't ever want to be that type of person that says, oh, things are only correct the way I do them, all right? But I can tell you why I don't do it this way, because there's a scar and there's a higher incidence of lower lid retraction. So I do what's called a transconjunctival approach. That means we're going through the conjunctiva. So we're making an incision on the inside of the eyelid. So number 1, there's no scar. And again, using the laser or the radio wave, it's a bloodless procedure. And we can access the extra fat through this small laser incision, and these fat pads will be easy to get to this way. And again, there's going to be no scar for the patient. And it's important that in the lower lid we have 3 fat pads. There's usually 2 in the upper, but there's a nasal, a central, and a lateral or temporal, it's also called. So these are the 3 fat pads. And some surgeons seem to have a hard time finding the lateral fat pad, and I'll tell you about that. But generally, for people that have fat bags, it usually has to do with, you know, more often than not, all 3 of these fat pads, but sometimes it's just 1 or 2. And there's a lot of blood vessels in these fat pads, and I've already told you that bleeding behind the eye can be a catastrophic situation. So it's very important to use a laser or some type of electrical cauterization to make sure that there's no bleeding. So some people use scissors. I don't do that. Now, here's a patient that came to my office. She had eyelid surgery elsewhere, and you can see she's got a bulge there. Well, what that is, that's that lateral or temporal fat pad, and it's not uncommon, especially with novice surgeons, that they don't get enough of the fat pad. They don't take it away or they can't find it. And again, complications can happen to any surgeon, and it's not really a complication because you just go back in there and take some more fat. But I'm just saying experienced surgeons usually will be able to recontour all those pads. So this is a patient that has a lot of fat here. We're rolling the eyelid down. This is the transconjunctival incision we make inside so there's no scar. And using the CO2 laser, we'll make that incision. And this heals very rapidly in a couple days. And you can see that on this particular patient, he has a lot of fat, and this fat is bulging. This is more fat than your average patient has. And we'll tease this out. And then again, we don't want any bleeding, so we're going to use the radio wave bipolar forceps to cauterize the base of this fat when we remove it. And we sometimes we just recontour the fat. Usually we take a little bit of fat, but it's important, obviously, that you only take the excess and you leave the normal. Now, one of the things about the transconjunctival approach is that it doesn't do anything for the skin. So when I showed you the earlier slide of the external incision, you can cut some of that skin off, and then when you sew it, it will look tighter and less wrinkled. But the situation is you're just stretching the old skin. I like to make new skin on the lower lids, and since I don't have any incision on the outside of the lower lid, I'm either doing a chemical peel, which I usually do on patients with darker skin or pigmented skin, or a CO2 laser, which I do on patients with light skin. I prefer the laser anytime I can do it, but both of these procedures will literally burn off the old, wrinkled, and very frequently darker skin, and new skin will grow back, and I like to call it baby butt skin because it's brand new skin, and it's smoother and has less wrinkles and is lighter. So when I do the transconjunctival approach like I just showed you, then I will usually be doing a laser, and if I'm not doing a laser, I'll be doing a chemical peel, and that's how I address the skin. As I have stated, the CO2 laser is my go-to for treating the lower lid skin. I don't like to make incisions on the outside. You can see how the laser tightens the skin. You can actually see the skin tightening as I use the laser. And it is very effective. We do that on the upper and lower lids, and it will tighten the skin. It will get rid of many of the wrinkles, and it will make the skin brighter and lighter. So here's a patient, and I did lower eyelids, and you can see the wrinkling before her surgery, and you can see how nice and smooth that is from the laser. And this is probably a couple weeks later. Now, some people will stay pink, and they can stay pink. Women can cover it, or men really, with makeup, usually around 7 or 8 days. If you're pink, you can cover that with makeup. Sometimes the pinkness lasts a while, but again, people just cover it. Now, I mentioned festoons earlier, and this is another area where we will use the laser. So I did upper and lower eyelids on this patient, and then I lasered, so I took extra skin, muscle, and fat on the upper, took extra fat on the lower, lasered the lower lids, and then lasered these festoons. So that really tightens the skin and makes new skin. And in my experience, there's nothing that gives you as nice of a result. So you're going to look bad for a week. You may look pink for a couple weeks, and you cover it with makeup, but the end game is well worth it. Another patient And you can see she has some festoons, she has crinkly skin, she has some protruding fat, and she has this pigmentation situations. And so doing her upper lids, doing transconjunctival lower lid without a scar, and then lasering the skin. So you can see that's kind of my home run go-to for eyelids. Now, occasionally somebody doesn't want a laser or doesn't want a chemical peel, or they have extra skin that maybe I don't think that the laser would handle, then I'll do a little procedure called a skin pinch. I don't do it very often, but you can actually just take a little pinch of skin off there and close that. And it heals nicely, although as I told you, I don't like to make external incisions. So here is a patient with a skin pinch. You can see where the stitches are. And then this is a chemical peel taken right after the procedure. And this is about a week later, so she's still a little pink from the chemical peel. And this little incision under the lashes is healing quite nicely. Now, you can have, and I've told you a lot of things to look for in an experienced surgeon, but your surgeon is only part of the equation. And a lot of how somebody is going to heal, how the result is going to be, and what complications they may have or may not have, has to do with the patient. So this is really important for patients to follow directions. And I have my patients put cold packs and ice on their eyes immediately. My patients are asleep when I do this surgery, and when they wake up, they have an ice pack on. They want to keep their head elevated. They don't want to do any activity that's going to increase their blood pressure, and that's bending, lifting, straining. And this is one thing where you really, especially with men, you really got to be vigilant, because people say, well, I got a week off of work to do my eyelids, so I think I'll clean my garage or paint my bedroom. This is not a time to be exerting yourself or bending or lifting, because it can lead to serious complications. So you need to take it easy for about a week, and then patients can resume working out. We put these patients on a pain medicine, antibiotic, and sometimes a steroid. And basically, I'm always on call. So if a patient has a problem, they can call me. But eyelid surgery is it's really rare to have a problem. And especially one thing that I haven't mentioned here that's so important is bleeding. When we talk about bleeding, patients must refrain from taking aspirin or fish oil or high doses of ginkgo or ginseng or garlic 2 weeks before their surgery, because these things can affect their coagulation. And again, if somebody bleeds after eyelid surgery, it can be a problem. So that's very, very important in our preoperative regimen, and all my patients know that. So now we're going to show you some before and after cases. And if you go to my website, lovethatface.com, I have almost 10,000 before and after pictures of all the cosmetic procedures I do. So there are thousands of pictures of eyelid surgery. And I'll just show you a couple cases right now. So here's a patient before. You can see that she has hooding, and after, you can see that we have this nice shelf here. And this is where women put eyeshadow. And once they start aging and get this extra skin, they can't wear makeup like they used to, or it'll smudge. So that's one of the nice things that female patients like. Also, this patient had some pigmentation and some fat pads, which you can see on the lower are improved. Here's the same patient, the extra skin, the crinkly skin and fat. Now we have a nice shelf, and we have tighter, brighter skin. That's the other eye, so you can see the difference in the upper and lower lids. Another patient, and again, we just start to look tired and sometimes angry when we have this extra skin. So this is a patient before and after blepharoplasty. Same patient, we get rid of this and give that more youthful eyelid. And I think this picture is about a month after surgery. You still see scar hasn't healed here, but that will heal. So this is upper lids only. We didn't do anything to the lower lids on this patient. Same patient. And some people have really big fat bags. And so here's a patient that obviously before and after, female patient with really large lower lid fat pads, and did upper and lower blepharoplasty. It's before, after. And this is just a, kind of a typical case. This is male patient before, after. I'm sorry, it's not a male patient, it's a female patient. But, it's the same situation. We're getting rid of this extra skin. On males, we wouldn't make the shelf quite this high because you don't want to feminize a patient. And just before and after, before, after, before, after. Another male patient where we took skin and some extra muscle, and recontoured the fat on the upper. And you can see this crease is lower when I was talking to you about the height of this crease. Males have lower creases. The distance from the lash to the crease is lower. And we've recontoured this extra fat and lasered the skin. Another patient, same thing, taking away this extra skin to improve the upper lid. Here's a patient with this gentleman, really his vision was blocked by his skin, and he was so thankful that he was able to see so much better after his surgery. It just, the skin was in the way. Another patient, upper, lower, with lower lid laser. So again, I do upper blepharoplasty, take away extra skin, muscle, and contour the fat. On the lower, I do the transconjunctival approach through the inside, take out the excess fat or recontour it, and then laser the skin. Another male patient, and you can see we got rid of that extra skin. And again, as I've illustrated, you have a lower crease on males. Females are about 10 to 12 millimeters. Males are about 8 to 10. Asians are about 0 to 4. Same patient. Same patient. You can see the improvement in the upper and the improvement in the lower. I believe this slide's out of order. It should have accompanied the other view of this patient. But nonetheless, you can see we removed that extra skin, and we've taken some fat out of the lower and recontoured that to improve that. You can't really tell so much in this picture, but this patient had lower lid fat pads. And again, we talked about heredity. This is a young patient. I've done patients in their 20s. And when you have people look up at the ceiling, that accentuates this fat pad. So that's why we do this particular view. But my point is that some patients, here's another guy in his late 20s who just had, heredity, extra skin, muscle, and fat on the upper, extra fat and crinkly skin on the lower. So that's before and after. So I could show you literally hours worth of before and after pictures, and I think by now you understand why blepharoplasty is one of my favorite procedures. And obviously I take great pride in what I do in terms of the equipment that I use, the safety with our operating room, our surgery center, my staff, myself, and how we do things. And I consider myself a good blepharoplasty surgeon, and I just get excited when I do these procedures. We do multiple blepharoplasties every week. And when you're looking for a surgeon, again, as I mentioned, you want to find somebody who has an accredited facility, somebody who can show you their work, somebody who obviously is educated about the anatomy, the surgery, the complications. And there are literally thousands of people around that can do this. I'm by no means the only person, but Because I'm so passionate about it, we do see a lot of out-of-town patients, and they'll come to Richmond here for their surgery. They usually come the day before and stay a couple days after. And again, it's just something I love to do. One of my mantras is to always be a teacher and always be a student. We never stop teaching and we never stop learning. I thank you for your time. I'm Dr. Joe Niamtu, lovethatface.com.